Superintendent, would you be able to do your superintendent report prior to going to SBB?
I'm having so many technical difficulties with WebEx this morning, so let me just send my PowerPoint to Mr. Van Holten, and I can do that. I just feel like we're all jinxed this morning a little bit. Not sure what's going on. I apologize. Okay. Jeff, let me know when you have that. Well, good morning, board members, to you all anyway, while we're waiting.
Good morning.
And actually, okay, I think we're ready to go. I'm working from a phone and a computer this morning. And for some odd reason, WebEx stopped liking my microphone. Every other platform works. So I really apologize. We'll start out by, let's see, Jeff, just if you'll advance the slides. I want to give a shout out to some really heavy lifts. And if you'll indulge me a little bit, I don't have everybody's name on here. I got some more information this morning, but you know about the heavy lift with our licensing upgrades. I mean, it's been monumental, not just only in policy, but all the technical aspects behind it. And I know that Deputy Jones has been reporting on this in finance, and sometimes you hear about it in the full board meeting. But each year, for those of you that are a little bit newer on the board, all of our cactus data, meaning all of our educator data, rolls over on July 1. So we basically have to shut everything down and shift the data to start a new year. Now think about that with all of the new licensing processes. And we're rebuilding Cactus, because remember, that's the one we always talk about, one of our older systems that has been held together by baling wire. And so really prioritizing that and revamping it, while at the same time putting a new licensing system into place. So that's been this really monumental lift, and it just took all hands on deck because we were getting down to the wire and some things were not coming into place. So I really want to give a shout out to the Cactus team. And the people on that team were Maria Bates, Casey Child, Tim Davis, Floyd Edwards, Kent Lindquist, Roxanne Joland, Kevin Woodruff, and their development and teamwork and dedication was amazing. So you only see a few members here because I realize I've got the wrong slide, but I want to give them a public shout out. And then their development efforts in conjunction with close coordination with teaching and learning. So that was Jane Conway, Kristen Campbell, Malia Height, Erica Horsley. That led to this just amazing closeout of both the teachers supplement salary programs, the TSSP, which is a huge monumental lift, and then getting all those payments out, and then the Cactus rollover. So thanks so much to everybody. If you think about this impossible task of retooling the Cactus system and 19 licensing types, we went from 19 licensing types to 3 licensing types. I know if anybody on the board, probably board member Lear, has the best appreciation of all of this, knowing that we used to deal with all of these various types. So it's just been amazing. I'm just so proud of every single member who contributed to these efforts and achievements. So thank them for their teamwork, their dedication, and perseverance with these notable and tremendous lists for the TSSP and Cactus system. So just thank you. Silent clapping for that, for everybody who was responsible. Next slide, Jeff. Thank you. It sounds like we have a mic on in the background. Okay, so I want to talk a little bit about reopening requirements. And this is something that I feel like I spend every day on, and I'm just really proud of all of our educators who are working so hard to make this happen for our students and families in the best way possible. So, in thinking about uh, where we're at and what needs to occur, I want to just talk about the process that we've been using to help our system with the plan. So, we're we're not talking about how to do it with them per se, but really trying to clearly articulate what to do and enabling some adaptability and innovation. If you think back to that graphic organizer that we use on reimagining what systems can look like, I'm so hopeful that we can get there. And I've seen a couple of plans where they're really thinking long term, not just about COVID, but in this time of trying to get our schools reopened in a very safe way, really helping people think about addressing all the elements that were approved by you on August 1st, and then applying a set of principles and levers to mitigate risk so that everyone can feel as safe as possible. And then locally, our LEAs determine how to appropriately mitigate those risks using various tactics and their specific setting. And then also asking them to address those minimum required mitigation tactics that were determined by you, like to be consistent statewide standards of expectations. So we've done that through some training, and particularly on these 7 characteristics. Jeff, if you go to the next slide, please. Part of our training with the Levitt Group has really helped us think very differently than having an 80-page manual that's step by step by step, really getting our system attuned to these 7 characteristics of any situation to consider when they're making decisions about their classroom, hallways, assemblies, entering into the building, etc. So we've focused on, for example, movement. If you look at this little graphic where you kind of see the neat rows, that connotes controlled movement versus movement that isn't controlled. So thinking about spaces like a classroom, you can kind of control movement around there and give direction. You can control movement by spacing students as they come off of a bus, for example. But in hallways, it's a little harder to contain that movement. So then you have to think about other issues of, would you have students put masks on in the hallway, or would you use staggered schedules for how you excuse your class to go to the next class, etc. The next characteristic that we've been working with them on is duration. So thinking about, are you spending time together for more than 15 minutes, or is it just a few minutes? And given the duration of students being together, then you mitigate it with other scenarios. So that the time that students are together also is an issue. Thinking about proximity, we've used guidelines from CDC and other places about proximity. 6 feet is the common spacing that we think about. So if students can't be spaced, then what other mitigation factors might you use? Group size is really important. So a lot of people talk about what's been done in foreign countries and looking at classrooms. Well, if you start out with 20 students and you can stagger and have 2 groups of students and be able to spread them out in a class, or you see 6 or 9 or 10 students in a class, but that's not really feasible for a lot of our suburban and urban places, and including some of our rural settings where they're really growing. So how do you mitigate group size? Maybe you use staggered schedules, blended models, etc. The fifth um, situation or characteristic that we might think about in a situation is respiratory output. And that's where masks are so important in our community. And thinking about things like sneezing, coughing, singing, where that respiratory output extends beyond 6 feet. So some of those courses have to be mitigated. Can they be held outside? Can they be held in a large auditorium with students spread out and extra cleaning? So those are ways to think about how you mitigate this characteristic of respiratory output. If you are a speech pathologist working one-on-one with a student, can a shield or a plexiglass barrier be put in between you, or a mask with a clear space over your mouth so they can hear and see you? And then touch is very important. So our students are frequently touching surfaces. Let's think of going in and out of a classroom door. Can doors be then propped open to minimize touch? Students being taught how to be part of the classroom experience of cleaning. If you leave a keyboard, the student cleans that off with appropriate cleaning supplies, etc. So thinking about all the surfaces where there's high touch. And then congestion. Students tend to come in certain doorways, and so how do we mitigate that congestion so that we don't have everybody in one space at one time? So, given all of that, this is just a way then for us to all think about the characteristics of the virus and how we mitigate risk rather than trying to tell everybody what to do, one size fits all, that there are scenarios in every classroom, in every school, in every community, that if you think about these characteristics, it can help in our students and faculty being safe. Next slide. Thank you, Jeff. In order to get feedback, as I've mentioned before, we have a bunch of advisory groups, and it has been very helpful to be able to listen, to hear different scenarios, and to get a progress report. So since our last full board meeting, this is what I've been engaged in, really listening to our stakeholders. I have a COVID-19 advisory council, just as a reminder, and this is made up of education stakeholders as well as representatives from childcare, from um, a variety of nonprofits, from health departments, et cetera. So really trying to get everybody at the table who has anything to do with the community of educating students in health and safety as well. And really so helpful to hear all these various perspectives. I also met with the teacher leader advisory group this week and to hear their perspective. If you follow social media at all, you've probably seen a lot of postings about concerns, or maybe they've emailed you directly. But we do have teachers that are concerned about their not only their own health and safety, but also thinking about some contractual issues. If they get ill at school, do they have to pay for their sub? Do they use sick days? There are a lot of issues that they're very concerned about that need to be worked through from an HR perspective as well as safety and health. We have a principal advisory group, and it's really interesting to hear them now think about how they take what their districts are working on and apply it in their own setting, and how they're working to communicate with their staff and their community. District superintendents, I pulled them together. I have a superintendent's advisory group, but I met with both the superintendents and the charter directors this week to get a progress report. And basically it was just an hour of listening, but trying to ascertain, are they thinking about multiple plans? How are they mitigating a variety of circumstances? How are they preparing teachers to be nimble and to be better at remote instruction and remote education? And then how are they communicating with teachers and staff? Because that's one of the things that we've been getting feedback on, is just this variety of communication strategies. So those are the things that we talked about. And it was nice to have them be able to share with each other what they're doing. We've held 2 webinars. I think some of you were able to jump on the webinars, and they are recorded and on our coronavirus website. And the purpose of these webinars, sponsored by us and co-facilitated by Levitt Partners, was to really provide templates and tools and just help them walk through these a variety of scenarios and teach what the virus is, how it operates, and how to mitigate it. And we've had so much positive feedback about these webinars. I think we had, if we count everybody that was on there, and there might have been some repeats, so I would say well over 500 attendees. And again, because they are recorded and available on our website 24/7, then we anticipate there will be many others who will download and watch these webinars. And the common comment that I've heard is, I was introduced to things I hadn't thought about, and it gave me ways to think about a variety of scenarios rather than just a how-to manual. So, and that was the intent. So we appreciated that good feedback. I've had many individual consults with charter directors and superintendents as they're putting their plans together. And it's really just trying to run scenarios by us, and thinking through especially blended models and how they might work within their schedules and what counts as a day. And I know finance is going to talk about some of that, but that's been an important conversation to have those individual conversations. Um, and then last but not least, I'll be meeting with health department leaders tomorrow as the virus continues to spike. We we've got to lean in as a state and do things differently. But I really appreciate the relationship that I have with these great people, and also reiterating to them the importance of making sure that our charters are contacting them and vice versa, that they develop relationship with our charter schools as well as our district superintendents. I think our superintendents feel like they have a good relationship. They know who to call. They've been working with them closely. I'm not sure that's the case with a lot of our charter directors, and they want to have those same relationships so that they get the support they need. Um, so some of the common strategies that we're hearing. Next slide, Jeff, please. Some of the common strategies that we're hearing in the plans, we haven't seen official plans yet, but again, these are just preliminary conversations. I don't want to mention any districts or charters in particular. Um, I want to protect their privacy as they're developing their plans, but just some common threads that seem to be popping out. I was pleased to hear that they are really thinking of multiple ways, again, trying to be nimble and adaptive, but providing face to face opportunities, blended opportunities, and remote learning options. I'll give you an example of a rural district who talked about having a 100% plan, a 50% plan, and a 25% plan based on where we're at as school as we get closer to the school year in terms of the virus spread in their particular county. So they're ready to be nimble in any of those three scenarios where 100% of the students would be face to face, 50 would be face to face, with 50 in a remote. So that's a blended model. And then 25% face to face and 75% in a remote model, which is also blended, but a little more leaning to the remote space. So those are the kinds of things that are being developed in order to be nimble and adaptive. One of the things we've talked about, if you go back and think to those 7 characteristics and how important it is to think about movement and group size and all of that, really trying to keep cohorts of students together where possible is key. This is something that Colorado is really focusing on, changing schedules and doing whatever they can to keep cohorts of students together to mitigate risk. One of the things everybody's focused on, of course, is updated hygiene and cleaning protocols. And we've encouraged them to really involve students in this as well. We teach procedures all the time in our classrooms. And so teaching hygiene and not just hand washing, but how do you care for the space around you? Washing off your desk. It might be when you come in and pick up your Chromebook in the morning, the first thing you do is clean it off, or when you end the day, you're cleaning off your Chromebook, et cetera. So really building that into the procedures in classroom. Another thing is using individual supplies instead of group supplies. This is something that we've migrated to over the years of group work and teamwork and learning communities and having students sit at tables instead of desks with community supplies in the middle, teaching kids how to share. Well, now in this space of COVID-19 and really trying to be mindful, then going back to individual supplies. And that's a different way of thinking for a lot of our teachers who've been so used to using their meager supply budgets to buy community supplies. And it can be things like manipulatives with tiles. Think of all the manipulatives we now use in mathematics. And so how do you mitigate the germs that might be there? And it causes me to pause and think about flu season and colds and everything else. And this might be a year where we see fewer colds and flu as we engage in these hygiene processes. Many are figuring out how to stagger their recesses and lunch, arrival times and exits from classes, et cetera. So again, going back to group size and congestion and movement. So thinking about how they stagger all of that. And that's a big challenge for our principals to really redo their schedules and think about all of that. A lot of people are talking about face coverings on buses because it's required, but also thinking about just saying that every student will be required to have a mask is helpful, or a face covering rather. And then when they move into the hallways or places where it's crowded, the expectation is that they will cover their face. And I will say, regardless of what feelings are about masks or no masks, and I certainly think it's important for every student to wear one. But I will say that um, I want to put this out there that students rise to our expectations. So when I hear people say students won't do this, or they're used to doing that, or they won't cover up their face in a hallway, They will if we teach them and monitor and teach and monitor and teach and monitor. That's what we do with other procedures all the time. So we have a lot of our districts and charters who are already thinking about places where they may need a face covering and it may be appropriate to not have one. And then I think one of the most important elements that we're hearing is the summer work and into fall, the work of professional learning for our educators to improve remote learning. I'm so appreciative of the reflection that's been occurring amongst our teachers and our system leaders about what didn't work in the remote space and what they can do differently. And a lot of work being done there. I'm so grateful to our teachers. I know this is such a trying time for them just to try and figure out what it will look like for them. And so I appreciate that they're being reflective about their own teaching in the midst of all of the unknowns. So there are also some common challenges that we're hearing, and that's on the next slide, Jeff, if you don't mind. Thank you. Some of the common challenges that we've heard last week or two is funding. So we've had CARES Act funding, we have GEAR funding from the governor, but this concern that even though we're helping with our set aside, they feel like they'll still need additional funding through the year, and that's to cover both cleaning supplies and additional student supplies. Going back to what I talked about earlier with some of the needs for individual manipulatives and crayons and pencils and folders and whatever it is that they will need additional money throughout the year. I've already mentioned this concern about teachers and their HR policies with sick leave, and it's hard to come by substitutes anyway. But if they contract the virus and they're out for a couple of weeks at a time, what does that mean for their sick leave? And districts and charters are approaching this in various ways because those are local HR policies. Teachers are very concerned about the lack of a mandate for student face coverings. If you watched the news last night, we have legislative leaders who were vocal about not mandating face coverings. So we'll see what Governor Herbert announces today. I think he and Dr. Dunn are making an announcement around 11:30. But our teachers, we're asking them to we're mandating actually or requiring that they cover their faces, but they are very concerned about students. And so working through those mitigation strategies of when students need to have face coverings or not, I think those are still challenging issues for our local districts and charters to work on. And one of the big things that they're concerned about is meeting all the parent expectations for learning options. You know, because you're getting emails daily from a variety of opinions from parents about mask or no mask, things about food allergies, things about contagion. There's just a lot of information out there. And so trying to provide personalized options for families, I think our systems are feeling overwhelmed about how to do that and do it well, knowing that they're going to have unhappy families at some point who may not be able to get their needs met exactly the way they want it. So that's a challenge. And I'm just expressing what we've been hearing. One of the big challenges is providing daycare for families during hybrid and remote learning. So if you're on an AB day and parents are working and on B day, there's nobody to care for the children. Tracy Gruber from DWS has been an amazing partner. And as we hear from her, they don't have the capacity in daycare, having enough of them and then having that coordination. So we do have some out of school programs like Boys and Girls Club and others who are willing to step in and support our schools. It's an opportunity for us to work with community partners and provide support for our students if they need to be in a place like a library or a Boys and Girls Club or some place where maybe there could be a paraeducator with them helping them. So this is a space where we're going to need a lot of cooperation and creativity. There are some of our charters who, excuse me, some of our charters who serve students that are in various risk areas. For example, I will mention Wallace Stegner. I think they're a good example. They draw a lot of students from Granite boundaries, but they're in Salt Lake District. And right now, Salt Lake is in orange, Granite is in yellow. So they're challenged by wondering about the variety of restrictions on their school. And those are just some inherent community challenges, and especially with that color coding. So we've encouraged schools like that to put your plan forward and do what's best in terms of safety and health, but not sacrificing quality instruction. And that's an important link for every school, that those can go hand in hand. We don't have to have one or the other. I've already mentioned a little bit about communication. This is something that we're seeing in such variety around the state. Some districts and charters have really involved their teachers and administrators and families in helping to plan. Some have sent out surveys. I think almost everybody has sent out a survey. Um, Sometimes there isn't narrative with the survey or feedback once the survey comes in. So some of our teachers aren't sure what that means for them. So that communication is tricky. And we would encourage everybody to keep communicating with their staffs and families about plan details. At the same time, if you put too many details out into the public, it's captured in the media as if it is the plan. And our superintendents and charter directors were really clear that they're still in the planning phase. They haven't had their plans signed off on. So they put a draft plan out, but then there are a lot of details that need to be put into that plan. And that will happen in the next couple of weeks before they come to you. Another thing is this idea of consistent symptom monitoring. We're really leaning on families to monitor symptoms of students before they get to the door, and to keep students home when they're ill. This is true for teachers as well, and the adults are the staff in our buildings. And so being consistent about that and using the right protocols is a little bit tricky. We know that some families, for whatever reason, need to send their students or have sent their students to school sick. So those are some adjustments that will be really important in how we monitor symptoms. Last but not least, there's a lot of conversation about testing. And while we have some tests that are being set aside and available for our teachers and students, when does that happen? Where do they go, et cetera? So the key is to have low cost or free test available to our families who don't have insurance and our teachers. So really, that's something that still needs to be worked out. I know for some businesses, people are tested before they come back to work. But in the case of schools, we probably need to stagger and have some of those available. So that's still to be determined. But just know that the unified command structure under the direction of Jess Anderson and General Burton are always thinking of our schools and setting aside tests and trying to find extra protective gear. And I'm so appreciative of that unified command structure and everybody who thinks about our students and our teachers and administrators and trying to do what they can to get supplies in the pipeline for us. So these challenges that we have are both adaptive and technical in nature. Thank you, Jeff. And I've been reading a leadership book that talks about different kinds of leadership and specific to challenges. So some of our challenges really are adaptive, and these are situations where maybe there isn't a known solution to the problem, or there are too many solutions without a clear choice. And they're fluid and they change with circumstance. That's how I feel about a lot of the things that we're facing. And there are also technical challenges, and they can be resolved just using what we know with knowledge and expertise. They're easy to identify and define, and they're pretty clear cut of what needs to happen. And people in the organization are often relieved when this technical solution is put in place. So I think this is a lot of what our teachers and our families are wondering about. There's sort of this sense of loss of what normal school is, whatever normal looks like, and also a fear of the unknown. So thinking about loss and fear for our families, our students, our teachers, that's a lot of what we're seeing in media and the emails that you're getting. So there are some technical answers to some of these technical challenges that a practice can be put in place or a quick answer. But I also think we have to be patient with these adaptive challenges and just know that things are going to be tried that may or may not work, and will continue to adapt and grow. And I'm so appreciative of everyone in the system thinking about what this means for the future beyond COVID. What can we learn from it, and how can we adapt as a system to provide a more personalized environment for each student that also gives them great choices for their future because they come out of our system better prepared. So thank you for your support. This is such a challenging time, and I know that you are having a lot of conversations like I am, and I have confidence in our education system. I really have confidence in our teachers and our leaders that they can come up with solutions that are safe, provide quality instruction at the same time. So thank you.
Thank you, Superintendent Dixon. Okay. So we'll go back on our agenda and move forward with the Utah Schools for the Deaf and Blind portion of our meeting. We'll start, excuse me, Board Member Earl, did you have a question?
Yes, sorry, I had to find the unmute here. I just have a couple of questions. Superintendent, if you don't mind. I have a question. Are any of the schools talking about helping address things like building immune systems? For example, just encouraging coming up with some dialogue about getting more sleep or fresh air, eating healthy. I know those are built into our health curriculum, but just in general, I'm just wondering if anyone's carrying on dialogues about not just contracting the disease, but help to build our systems to, overcome something if they do get ill. Are you hearing that? I'm just wondering.
Not specifically. I think people are so focused on trying to mitigate the risk, but I love that suggestion where really, as we're talking about hygiene, to add all of those healthy living pieces to it about sleep and nutrition. So that's a great idea. We'll push that out. Thank you.
Okay, just wondering on that. And then I just am seeking a little clarification on the, so as you, and I'm grateful that we're pushing for an August 1st deadline because really that helps parents make the decisions for fall, right? As far as what they need to make decisions on either scheduling with work or scheduling with, some kind of a supervision for their children. But I just wondered, I was just looking for clarification. Are you suggesting that somehow we're responsible for some of that daycare responsibility? And if so, okay, so you're saying no. So you're just talking other programming in social institutions, that kind of thing.
I think it's important to have dialogue with with providers so that you know what's out there. When I was a school principal, I knew who the daycare providers were in my community, and we worked well together. And it's you want to know what's available to help families. If a family comes and says, you're changing the schedule, but I work and I don't have daycare available, then at least a principal can be equipped to say, well, here's 3 opportunities or possibilities in the community that you might check out.
Okay, you're saying knowledge of resources then. I didn't quite hear it that way. Okay, thanks for the clarification. I appreciate it.